This is the physical exam in the online consult webinar. I am Katie, Katie Barron. A lot of you guys know me, some of you don't. I am a college lecturer at Endeavour on the Gold Coast, and I've been teaching this subject for about 4 or 5 years to third year naturopathic nutrition and acupuncture students. So I have a lot of fun doing it. I really enjoy it. It is definitely something that I noticed that, and I'm sure you guys can relate, is that you do a little bit in your formal training and then everything's a bit of a whirlwind and you come out and you go into practice and you don't really feel very confident. I have put together the Let's Get Physical training program, and that is the complete package of everything. Obviously, what we're deep diving into today is the online component of it, and basically what we can do online, which is really important. Okay, now before we kind of just jump straight into all of the info, now all of the info is wonderful and all of the info is partially why you're here. But the other reason why you're here is because we care. You all got into doing this work fundamentally, tracing things right back to the fact that you just genuinely like to help people. And especially with what's going on in the world at the moment, it's a really crazy place. And I want us to really keep coming back to that we are here because we care. We don't need to know everything. We don't need to have all of the answers. We don't have to be gurus. We just have to show up and do the very best that we can and make sure that we are being of service to these people. Okay, so some of the things that I encourage you, and I actually encourage you when you decide to put your physicals into your online practice, is that one of the things that you put in your welcome email is what you expect your patient to have on hand when they turn up to the online consult. Just like if you were asking them to bring in a physical diet diary to your face-to-face, there's going to be some little bits and pieces that are going to be different with the online consult, and especially if you want to be doing some of these things that you're learning today. So I encourage you to ask them if they have a blood pressure monitor, and if they do have blood pressure issues at all at the moment, they will definitely have one already. If they don't, that is a real worry, and they should be hot-footing it to the chemist or buying one online, and you can advise them about that too. A thermometer. Now, we can get a million different types of thermometers. I've just got one of the little digital ones from the chemist, and we'll be talking about that soon. And a measuring tape. So once again, we measure things in centimetres here in Australia, and that is what I encourage you to have your patient on hand as well. If they don't, it is not the end of the world. Yeah, but the way you can work around that is by asking them to make sure in your welcome email, these are the things that I'd like you to have on hand if you can. Okay, so starting off, just like we would with our face-to-face consults, we are doing our general survey. So just like if the person is walking towards you and sitting down in the chair in front of you, the consultation has started well before you've started asking questions. You're looking at them. Do they look well? Do they look unwell? What is their posture like? Are they sort of hunched over in one side? Is everything symmetrical? You'll hear me say that word a million times over the next hour or so. So do they look symmetrical? Are they sitting up straight, and is their chest risen, or are they sort of all hunched over and not really, don't really have good posture? So discoloration of the face in general, the lips and the upper limbs. What we're doing there is we're just looking, we talk a lot about colour and sort of the general things that you can look out for with colour as well a bit later. Obviously, we're looking for skin lesions and any rashes that we can see, just with the section that we can see. And obviously, we're going to ask more questions about anything that's going on in that area. I mentioned symmetry, huge, huge, huge. And are they relaxed? So, you know, if not, once again, sort of like the person that's face to face with us, is if they're not, is this circumstantial? Have they just been rushing around and they've finally got to sit down for the first time all day? You know, are they nervous about being online? One of the things that I implore you to do is just be online. If you're not online already with your patients, or if you have minimal patients, practice with each other. Right now, I ask you to get up and get down when I do, so that you just get really comfortable being online and seeing yourself in that little box in the corner, which can be confronting for a lot of people. Okay, and because they will pick up on how you're feeling. If you're just relaxed and you're just flowing through things as you would if they were in front of you, they'll go, oh, okay, this is cool. I've got this. Okay, body language. So, and the tone of voice as well. Obviously, you need to have clarity with your with what you're using for sound. So making sure that you're taking note of all of those sorts of things. And we talk a little bit more about that stuff when we talk about the mental state assessment. Okay, so into the vital signs. So the vital signs, you know, they're basically a group of medical signs. So we've got blood pressure, temperature, respiration rate, and also the pulse. And they tell us a lot about the general functioning of the body overall. Very, very important to assess. A little bit trickier online, but once again, we can get around this. So obviously, what we know, especially with blood pressure, and we're going to jump into that, is that the blood pressure tells us about the pressure of the blood traveling around the body. And as I mentioned, if your patient has a pre-existing heart condition, cardiovascular condition, they will probably have a digital monitor at home. And if they don't, once again, please encourage them to get one. All right, so when we're thinking about blood pressure, blood pressure, you know, of course it tells us a lot about the cardiovascular system and the heart and what's going on there. But naturopathically, holistically, we know that blood pressure tells us a lot about the vitality and adrenal function of that person in front of us. And also, you know, the pulse, which we'll get to as well. So when we take blood pressure, we are asking our patient to take their blood pressure right in front of you. So it doesn't matter whether these are the fundamentals, whether you're taking their blood pressure face to face or they're taking it themselves in front of you. But you've got to, you can ask them to use their digital monitor. You're going to ensure their feet are flat on the ground. They're not to have their legs crossed or their ankles crossed or anything like that. We want blood flow to be standard and steady. And also one of the things that I see getting done quite poorly is that when we do blood pressure, we want our arm to be at heart height. Yeah, so that brachial pulse, which is found in that antecubital fossa area in here, we want that to be at heart height, which is, you know, with women around, depending on where your nipple is, it's about the height of the nipple. So what we're going to do is you're going to ask your patient, to use the digital monitor. I'm a bit of a stickler for doing it manually face-to-face, but obviously when you're online, that is not a possibility. So we have got a cuff. Don't be like me when I was learning this way back yonder, and I did a whole blood pressure examination over my lecturer's shirt, and he just let me do the whole thing, which was extremely embarrassing. Okay, so one of the other things that I want you to know as well, a lot of these will have little arrows that will point down towards the brachial pulse. And I also want you to take note of where I'm putting the cuff. The cuff has to be on really, really firmly. So this is what you're going to tell your patient, is that it's on firmly and it's on up high, as close to underneath the arm as possible. And and just ask them to put their thumb and finger at the top and give it a little wobble to make sure that it's not slipping up and down. And then that's making sure that that whole area is clear. So basically they're going to put the cuff on and you're going to hit start. Feet flat on the floor, and you're going to watch for it to pump up. This is actually one of those things where if you decide to go online for everything, you could have in your shop as well for people, like a pack. So it's up, it's pumping up. That's the thing about the digital monitors. They pump up to within an inch of your life, which isn't the most accurate thing to do. But yeah, it's not bad. Okay, so I am 122/77. So that's pretty good. Usually I'm quite low. So let's talk about what that actually means. So when we are talking about 122, that number is our systolic number. That is the number, that is actually the blood pressure, that force of blood, the bolus of blood, which is about 70 mils, as it gets pushed from the heart, and that is the pressure of the blood when the heart is contracting. The diastolic, that bottom number, which was, what was I again, 77, 72, anyway, make sure you write that down. That is my diastolic. That is my number, the pressure of my blood after contraction, when my heart has actually, let me just add a few more people. When my heart has, after the contraction and it's relaxed. All right, so that is blood pressure. And, you know, if they don't have a blood pressure monitor, obviously you can tell them to go and get one. They're really not very expensive. And what you can do is assess pulse when we get to that. Okay, so as I've mentioned, the blood pressure gives us a picture of cardiovascular health and holistically an insight into vitality and adrenal health. So please don't overlook it. Okay, what's normal and what's not? So in the manual that I've given you, I have given you the guidelines from the Australian National Heart Foundation, and you can look at the different stages of blood pressure there. The thing that is really interesting is that in conventional medicine, hypotension, unless it's really quite severe, isn't viewed as an issue at all. And it's quite a lot harder to find papers and research and information about hypotension in comparison to hypertension. So, you know, but it is considered to be less than 95/60. Yeah, and as we know, really, really important for vitality of the person. Temperature. So temperature can be taken orally, rectally, axillary, or via the tympanic. So axillary under the arm, obviously oral under the tongue, rectally we do not do, and we certainly don't want to see our patients do that in front of us online, right? So although I hate to say it, it is actually the most accurate. Okay, so what we can do, what I like to do is I like to do oral temperature for adults and axilla for children. So it's, once again, it is, we don't take their temperature, they take it themselves. But one of the reasons why we get them to do this in front of us online, now you can do this as they're putting on the blood pressure monitor at the same time to save time, or you can just do it as is and write some little notes as they're sort of ticking away. But the whole thing is there's twofold. Is temperature, remember, it tells us so much about what's going on for them, whether it's acute infection, whether there's thyroid issues. They need to know how to do it properly to be able to assess fertility and ovulation. So making sure that they know that they're doing it properly is so important. And by you educating them on every little step, that is so important. So if you're telling your fertility patient every morning when you wake up, I want you to take your temperature, you know that they're going to do it exactly as you've shown them. Okay, so basically we turn our thermometer on. It will have, if you've got one like me, it will show you the last reading, and then it will, when it's ready to go, it will hit a little L. Then what you're going to tell your patient, there's steps in the manual, what you're going to tell your patient to do is to put their tongue to the roof of their mouth and then pop the little end of the thermometer in one side, either side underneath the tongue. So we say sublingual pocket, they will go, what on earth are you talking about? So we will say the little pocket underneath your tongue, they're going to push their tongue back down, close their mouth and hold it in place. Because the number of people that will literally just shove something in their mouth and think that's how they're taking their temperature. All right. Okay, so this is in the manual, but I just wanted to really quickly show you because I find it really, really fascinating, the human body and the healthy temperature ranges for things. So, this is the temperature range for oral temperature. So anything is considered healthy from 35.8 to 37.3. If I see someone that's at 35.8, I'm thinking that's a little low, as I can imagine a lot of you are too. And hypothermia is considered above 37.4, hypothermia below 35.5. And this is where it gets really interesting. So loss of consciousness between 30 and 32 degrees, and then you're in a lot of trouble if it drops below there. So that's, I just wanted to show you how quickly how important temperature is, and actually how quickly and how much impact it can make in different parts of your body. Okay, respiration. So when we are assessing respiration face to face, generally what we do is we do it at the end of pulse, and we tell the person that we're going to take their pulse again. Then we start looking for their respiration rate. Obviously we can't do that in our online consult, but what I get you to do is just to think about the respiration and think about what you can see and what you can hear. If that person in front of you is struggling for breath, or they are having to lean over. So tenting is quite common with people with lung issues. And what you'll see them do is you'll see them sort of lean over, and what they're doing is they're opening up that whole back side of their lungs and the back so that they can take a better breath in. And, and you'll see that people doing that as well. So with the respiration rate, I put this in because it's something when you're doing your online consult that you're actually just going to be, it'll be in the back of your mind. Can I even see them breathing? So as I've put here, a healthy person should be able to finish a sentence. They shouldn't halfway through a sentence to have to stop and catch their breath. And you shouldn't really be seeing a lot of accessory muscles being used when they take a breath. So when we get to the pulse, so the pulse, this is where I was saying the heart contracts and pushes a bolus of blood out, and that's usually about 70 mils per pump, per pulse, as it is. And then the force of that creates a pulse wave against the arterial wall, and that's actually what we feel. So every time that 70 mils is pumped out, it causes the arterial wall to expand a little bit, and that's the pulse that we can feel. So the pulse landmark. The pulse assessment is generally done at the radial pulse. Now the radial, we have two pulses at our wrist. One is the ulnar, and that's this little guy at the pinky side. And the only time you'd use your ulnar pulse is to assess for blood flow to the hand. The other side here, the radial pulse is right up near the wrist there. And it is actually, if we're thinking about, I'm going to stand up and do this. If we're thinking about anatomical position, when we're standing like so, with our hands facing forward, our radial pulse is, let me just move this. Our radial pulse is lateral to the radial tendon at the wrist. So lateral means further away from the body, and it's right up at the wrist there. The reason, you don't need to tell your patient that, but the reason why it's good to know your landmarks is because it's a good starting point. The human body can sort of be all over the place, but it's a good place to start. So what I suggest that you do is you're using 2 to 3 pads of the finger, and you're locating your own pulse right up in the camera to show them how to do it. Now, how we assess pulse online is that we're just literally going to ask our patient to start counting. Now that's going to, it's going to give us a rate, a pulse rate, but it's also going to give us we're going to hear them counting, and we'll be able to hear whether it's regular or irregular. Yeah? So first of all, we've got the pulse. We find it. The first beat, please do this. The first beat that the person says, and tell them to do this, is 0. 0, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. See, and I know with mine it was quicker, then it slowed a little bit. So what I want you to do is get them to count for 20 seconds, and then you are going to times that by 3. And that is how you're going to take pulse. And then as you're listening to them count, then you're going to know that whether it's regular or irregular. Okay, so it does tell us a lot about cardiovascular health, and once again about the vitality. If you talk to any acupuncturist, they will, of course, deep dive into the pulse. This is us skimming the surface to get another little clue as to what is going on with that person in front of us. And taking note of the changing pulse rate over the lifespan. So what I mean by that is, you'll see in your manual is that I put a chart in there with the pulse rate and what's actually normal. So you'll see that little bubbas, newborn babies, their pulse rate is so fast, it just flutters. And then adults generally there's 2 different schools of thought, but they are generally, healthy adults have a pulse rate of between 60 to 100 beats per minute. So that is what you're aiming for. You will notice as well that, when we're talking about tachycardia, which is an increased pulse rate, and bradycardia, which is a decreased pulse rate, we know that that well-trained athletes can have a slower, can have what could be perceived to be bradycardia, but they're actually not. They just have these hearts that are just so efficient that that each contraction just does its job so well that it doesn't need to be quick. So you will see all of that information in the manual as well. Okay, so waist-hip ratio. The waist-hip ratio, I will say ditch the BMI. I'm definitely not a fan. We're all qualified pracies and we know the limitations with the BMI. I much prefer the waist-hip ratio, and especially if you're online, it's quite easy. A lot of people have bathroom scales to be able to weigh themselves, but not a lot of people actually know exactly how tall they are. And remember that given what's going on with your spine, that can actually change over the lifespan as well. Okay, so remembering, as you guys know, that your waist measurement actually gives a lot of information about cardiovascular risk, abdominal obesity, and also stress levels, because as we know, with really high cortisol levels, that cortisol is effectively stored all around that waist as well, and is a massive contributor to abdominal obesity. So how do we do it? We are going to ask our patient to stand up and take, oh, hang on, I'll just let someone else in. And take their waist measurement. I'll show you where this is going to happen, because this is very, very important that it's done at the right spot. So ask your patient and do it along with them. I've got my my centimeters in front of me, and ask them to locate that so they're not measuring themselves in inches, which is really, really easy to do as well. Now, what I want to say about this is that to do waist measurements correctly, there's a couple of different landmarks and spots where you can actually do your waist and measure your waist. Flies up. Okay, so basically I always like to and what I implore you to do is to choose one and stick with it. And that will be what you do and how you take waist measurements. Don't worry about hip, that's super simple. Okay, so when we are measuring around the waist, we are taking the end that shows the in centimeters, and we are finding our landmark. So for me, I always like to take waist measurement right at the top of the iliac crest. So if you're looking at that picture that I've got on the screen, you'll see the superior border of the iliac crest. Basically, that is the very top of the hip bone. And it's actually quite a lot higher than what a lot of people think. It's really quite high. So then what you're going to ask them to do is you're going to ask them to, on one side, place their finger on the end of the tape measure, and then you're going to ask them to pull it all the way around and come back around the other side and tell you what your measurement is. And then when you have your measurement, you're going to write that down. That's going to be in centimeters. One of the things that I implore you to, I'll just do a bit of a spin around, that I implore you to tell people is to make sure that it's all straight. Now that's going to have a very different reading, isn't it, to this? And also the other thing is, if they have big jackets on, if they have jumpers on, if they have very flowy clothes on, then you take that off, obviously. The other thing is how firmly they tie it around. So it is quite firm, but it's not digging into the skin. And that is how you take a waist measurement. As I said, that is really, really important to make sure that you are, sorry about that. That's really important to make sure that you choose one and you stick to it, because it can get a little bit wobbly if you don't. All right, now the hips. The hips don't lie. That's pretty funny, isn't it? I thought I was being hilarious writing that. Okay, so what we're going to do with this is, once again, there's only one place where we take our hip measurement, so that makes it nice and easy. And that is around, it's not here. It's not up here. It's actually a lot, everyone is surprised by this. It's a lot lower than what everyone thinks. It is at the widest point. So when you stand, you get your patient to stand up, and I suggest you stand up and do this as well, is that you give your hips a bit of a whack, and it's that widest point there. Inevitably, we're going to do the same thing again. We're going to ask them to use the centimetre side. We are going to run our tape measure around, right around, until we get around, and we're going to take that measurement again, tell them to tell us the measurement. So once again, you will notice that when I'm doing this, it is nice and straight, it is not curved, and it's just nice and straight all the way around. The other thing to notice, it's really great showing over my bum, but the other thing to notice is that it's actually across the widest part across here too, really, across the buttocks. So that is something to remember. And it's really important to do these things. Like I promise you that as comfortable as I am just doing these things for you guys, if you can stand up and do these things with your patient, you'll have a giggle, they'll have a giggle, and it's part of a rapport that you will build that will get them coming back and get them going, hey, I saw this naturopath, it was hilarious. We were doing this online and you wouldn't believe the things she got me doing. So, you know, these are the things that you want to be doing. These are really big points of difference, as well as telling us so much information that guides our treatment plans and helps track progress. Okay, so then we get to the fun stuff. So then we know that the calculation is the waist in centimetres divided by the hip in centimetres. Now, if that is less than 0.8 for women or 1.0 for men, then you have an increased risk of cardiovascular events. So when I put increased risk of health risks there, I put that because as holistic practitioners, we know it's not just cardiovascular. We know that there's all of these other risks involved if you have that high waist-hip ratio. So I encourage you to make sure you're doing this with your patients. Yes, okay, what else did I want to tell you about that? Yeah, so make sure that you are doing it at the same time as them. Then you're ensuring accuracy. All right, now we're going to talk about nails. So when we're going to ask our patient to show you their nails. Do they have polish on? Do they have acrylics? And is there any issues with the toes? This is one of the things that I think a lot of prackies miss. Nail analysis is amazing. And then it's only half done because, you know, we have nails on our hands and we have nails on our feet, and they are both indicators of health. So I implore you to ask them about, you know, what's the nail health with their feet as well. So when I put my hands like that, you can all see my nails, right? Can you get a really good look of my nails? Oh, that one's a bit split. So there is lots that we can do. We can see it, just like if someone put the nails in front of us face to face. So when I talk about, obviously we know the toxicity of polish, we know acrylics as well, and also not just because of the the actual application of it. But a lot of these people who do their nails, get their nails done every week, are spending time in these nail bars, which is obviously not fun at all. Okay, so one of the things that that I want you to look at when you're looking at and doing your nail analysis is for clubbing. So basically this is when the tips of the fingers enlarge and the nails actually curve around. I think I've missed a slide. Anyway, curve around the fingertips. So this is basically like in the picture. Can you see, you can see a little gap between my nails, right? It's like a little diamond. If that was flattened, so you can all do that on yourselves. If that was flattened, that would be positive for clubbing. So clubbing gives us a lot of information about the chronicity of conditions. So when you'll see clubbing with a lot of really chronic, and it can be systemic stuff, like it's quite serious GIT, heart, respiratory, liver conditions. The jury's out as to whether clubbing reverses. And conventional medicine does recognise clubbing. So if that is something that you are putting in your referral letter that you have identified clubbing, then they are going to know exactly what you're talking about. So when we are looking at the nail, what we're doing is we're looking for the shape of the nail, the colour of the nail bed and the surrounding skin. We're looking at the moons, we'll talk about that in a minute, the quality of the nail and the skin around the nail, if there's any white spots or ridging and things like that. And as I said, we're assessing the whole nail bed, the skin around the nails, and both hands, please. Don't just have a little look at one hand and then move on. So nail presentation, so koilongia. This is quite a severe picture. Like it is a severe case that I've put there because I was trying to get a point across. But they can be very concave like that, or they can just be really, really flat. As we know, with a healthy nail, it should be curved. So yeah, that is something that you can be identifying as well. Why haven't I got my notes about that? Okay, so when we are thinking about that, about the koilongia, it can actually be like a skin reaction to detergents. It can be inflammatory, it's seen inflammatory skin conditions, and also endocrine and hormonal conditions as well. So yeah, just be on the lookout for that. Once again, it's just another little clue. Oh, I'll let someone in. Okay, so nail colour. When we are thinking about the nail colour, I want you to be thinking in general terms, and as we go through colour and we go through skin and eyes and things like that, you'll notice that when we're thinking about colours, there's general trends with things. So, you know, when we're thinking about blue nails, straight away, we're going to be thinking about the lack of oxygenation and cyanosis. So that is obviously the bluing of anything. So what's going on with the circulation? That deoxygenated blood is either pooling there and not going back to the heart, or fresh oxygenated blood is not getting there. So they are the things that you're going to be thinking to yourself when you see things like that. Black. Now, as we're thinking about with anything black, I'm thinking about very, very chronic. I'm thinking about death. I'm thinking about stagnation and toxicity. So with it's seen in anemia. It's also seen in B12 deficiencies. It's also adrenal issues and heavy metal toxicity. So also as well, please remember with a lot of these things that we see with nails is that it could just be trauma to the nail. So before we go down the rabbit hole of all of the things, and you know, anything that we do see is going to be triggering more questioning, right? But before we go down that rabbit hole, we're going to eliminate the simple. Have they given their hand a whack? So please, we use our common sense before we go down the rabbit hole. All right. Okay, so white spots. I'm sure you may be familiar with white spots in the nails. So that is associated with zinc deficiency, and the chronicity is going to depend on where the white spot is. So obviously, as our fingernail grows, it grows from the bottom there, and then it goes all the way up. So if we see spots right down the bottom, we're going to be thinking that they are relatively acute. Whereas when we're seeing zinc spots that are sort of all the way through and up here, it was from a little while ago. And if it's all the way through, that means that the zinc deficiencies is just been hanging around. Whereas if there's just one right up here, it was like, well, what was going on, you know, a month or so ago? What was your diet like, and have you improved it since? Once again, you are never going to be diagnosing, and you're never going to base your whole treatment plan on these things. But I promise you, when you identify little things like this with people, it's part of the picture, and they go, oh, actually, well, a month ago this was going on, and it's part of the picture of that person. Okay. So white and pale. So once again, when we are thinking about things that are very pale or very white, we're thinking about deficiency. We're thinking about weakness. We're thinking about, you know, and even when we think about things from a kidney point of view and TCM, I'm not a TCM practitioner. I have very, very basic understanding, but that it's that Qi deficiency. So, you know, we're sort of thinking about iron deficiency. We're thinking about all of the really important things, like, you know, your zinc and your protein and your iron, and and also like kidney and liver disorders as well, which kind of goes hand in hand, because, you know, when we think about zinc deficiency, we think to ourselves, is it a dietary lack, or are they just not absorbing it? Grey. So immediately when I think of grey, well, we think of ailments of the elderly, don't we? So what are the ailments that we think of with the elderly? We're thinking about arthritis, we're thinking about edema. Malnutrition is a really big one. Malnutrition, not just because of what they're eating, because remember, we are what we absorb, we're not what we eat. Glaucoma, lung issues, and cardiopulmonary issues as well. So that is grey. Make sure I'm still recording. Okay, yellow. Once again, if I'm seeing yellowing in the hands, if I'm seeing yellowing in the skin, what am I thinking about? I'm thinking about respiratory. I'm thinking about liver. I'm thinking about the lymphatics, especially if you're thinking about the lymphatics, especially if it's a little bit milky, sort of that pale yellow. Green is, this is obviously quite an extreme picture, but it's to show you what it can look like. And here we're thinking about allergies, and we're thinking about, obviously, fungal infections, be it acute or systemic, and also bacterial infections. It's kind of, obviously, as you can imagine, we're thinking about blood poisoning, so septicemia, and also you know, which could be associated with wounds and things like that. But also it is actually present in quite serious emphysema. So remembering that, you know, when you're looking at the nails and you're seeing this, you'll either go, that's confirming something that I was already thinking that could be going on with this person, or it's going to lead me into another line of questioning. Red. So once again, when we think about anything red, we're thinking about circulation, we're thinking about the heart, we're thinking about you know, and then constitutionally, anything to do with the heart, are they angry? Are they impatient? Are they kind of ruddy in appearance? So, you know, that's when we're thinking about red, we're thinking about the cardiovascular system. So brown underneath the nails, and these nails aren't so crash hot, are they? So the brown underneath the nails is seen in psoriasis. And once again, you know, I'm looking at that nail and I'm thinking about the drying of the skin. I'm thinking that there's essential fatty acid deficiencies and all sorts of things going on, as well as we'll talk about quality in a minute. But the quality of the nail, there's lots of pitting, there's lots of it's very brittle and dry as well, isn't it? So there's lots of possibly protein deficiency or malabsorption going on there. Okay, so here we go. In terms of the quality of the nail, so, you know, when we are thinking about things being brittle and sort of like flaking away, we're thinking about obviously contact dermatitis, trauma to the nail bed. Please, we're always thinking about trauma to the nail bed, always rule that stuff out. Idiopathic, whenever you see that word, it means that we just simply don't know. Idiopathic is, yeah, we don't know. So when we're thinking about the nail being thickened and hard, we're thinking about there being injury to the foot, and fungal infections is a really big one. And then obviously, please don't discount you know, poorly fitting shoes if their shoes are a little bit tight, and you know, and then obviously with poor peripheral circulation as well. We see that in the elderly, but we also see that in diabetes and lots of people who have got some more heart conditions and things going on with their circulatory system. Okay, so one of the things that I like, and it's a very holistic sign, so don't be going and putting it in your referral letter, because the GP will have no idea what you're talking about. But the lunula is our little moon. So I want everyone to have a little look at their moons and see if they have them, where they are, and how many of them that you have. So I only have them on my thumbs, and some people have them on all of their hands. Now, and also, is it quite bright white in comparison to the pinking of the nail bed? Now, the lunula will tell us actually lots of information, once again, on a holistic side of things, about the vitality of a person. And that is so cool to know, because that will help guide your treatment plan. If you know someone is not very vital, and they're quite depleted, and constitutionally their vitality is a bit lower, you know, are you going to be sending those people to F45 7 mornings a week and doing hardcore fasting and juicing with them? Or are you going to kind of go in a little bit slower? Are you going to go in with really, really high dose herbs? Or, you know, these are the people that are a little bit more sensitive and can use maybe lower dose and easing them into it a little bit further. And once again, from creating that rapport and creating that relationship with your patient, if you start chatting to them about their lunula, and they'll be fascinated, they'll be looking at their nails, and then you'll go, now, you know, this is what we know to be true about these, about the lunula, and this will help guide where we're going. They absolutely love it. Okay. So what else did I want to say about the lunula? Yeah, so the lack of moons, obviously, and so the lack of moons relates to a lack of overall vitality. So you'd see it in, you know, maybe a lack of oxygenated blood, an iron deficiency, mitochondrial issues, so really low cellular energy. I know that with people like that, they can really, really do well on coenzyme Q10. And once again, you wouldn't just give it to them because you don't see a lot of moons on their hands, but it's definitely one to think about. Okay, so pitting. Pitting is little dots all over the nail bed, and they're not punctured, but it kind of looks like someone's been going along and stabbing the nail. And it's actually seen in sarcoidosis, psoriasis. This is all in your notes. Psoriasis, dermatitis, alopecia, and what was the other one? Oh yeah, so inflammatory skin conditions. And you get the lollipop if you know the common thread with all of them. Yes, they're all have an autoimmune component to them. You all get the lollipop. So yeah, so, and as we know with autoimmune, there is such a strong gut component to our autoimmune conditions. So it's if you see pitting on nails, you're automatically going to be thinking about gut and autoimmune conditions. Thinking about it. Okay, Bowes lines, as opposed to the vertical ridging and the vertical lines that we often see, and I know I've got some, especially at the moment. Bowes lines is that horizontal line, and it will be one usually across the middle, but it will grow out, and this is as the cause, the underlying cause obviously is treated. So once again, we can see this if there's a nail infection, or if in psoriasis, that's a big one. And if people are picking repetitively at their nails, which are already brittle and dry. So you know, and we go, oh, well, that's just non-pathological. But that's actually a lot of signs in itself, isn't it, into what's going on with the person if they're picking at their nails and they have brittle nails. So that is Bowes lines. And conventional medicine does recognize this, so you will be able to put that in your referral letter. Okay, and now we're talking about the longitudinal ridging. So once again, you will be able to see that with people, but you will also be able to ask your patient as well to, if you all try it now, but ask your patient to just rub their fingers over their nails. Like I have quite significant ridging on my thumb, and then my other nails seem to be okay. And as I rub my finger over my thumb, I can really feel the ridging. So try it on yourself, and also ask your, no, I don't want to do that. Ask your patient to try that out. All right. So when we are thinking about the vertical ridging on the nails, we're thinking about digestive issues. And when we're talking about digestive issues, we can obviously have deficiencies in anything, because we are what we absorb, not what we eat. But in particular, there's like a malabsorption and a digestive issue generally in the upper digestive tract. This is the understanding. And there is in particular, there can be HCl deficiencies. And then you can ask yourself, is there malabsorption or malnutrition? And what's going on there? So obviously, if we've got low HCl in the stomach and that's not working correctly, we're going to have low absorption, especially of things like iron and calcium, B12 and other minerals as well. Cool. So the splinter hemorrhage. So this guy is a little, it kind of looks like a little splinter, exactly what it's called. So it just looks like there's a splinter up and under there. And obviously rule out that it's not a splinter. You're going to ask them to make sure that it's not. But this is associated with renal disease, obviously trauma again to the nail bed, fungal infections and psoriasis. Again, it is recognised by conventional medicine, so you can pop that one in your referral letter. Okay, the tongue. So when we're looking at the tongue, we are looking at there's four main aspects that we're looking at. We're looking at the colour, we're looking at the shape, if there is or there isn't a coating, and the moisture levels as well. So when, oh, picture's a bit blurry. When we are talking about the tongue, there are different body systems that are implicated depending on where you might see a different shape, a different colour, a coating. In general, in that section up the back, we are talking about anything relating to possible issues with the kidney and bladder intestines. Down the sides, we've got gallbladder and liver, and then up the front we've got like lung and heart, and then we've got there's stomach, and we often see, I'll show you my tongue in a minute for educational purposes, and you'll see I've got a stomach line down the middle of my tongue in my stomach area, which goes hand, I'm giving you my case history now, which goes hand in hand with my vertical ridging, which is showing that there's HCl and digestive issues with the stomach. Okay, so that is that in a bit of a nutshell. So go on, stick it out. So when we are asking our patients to stick their tongue out, they will have a giggle. It's really good fun. And the idea is that you want to give them a little bit of a brief introduction to what you're doing. If you just tell your patient to stick their tongue out, they're going to go, why? So the idea is we're going to go, I'm just going to get you to stick your tongue out. We look at different things and it tells us so much about what's going on the inside. And when I get you to stick your tongue out, I want you to stick it out and just make sure that it's quite close to the camera so that I can see what's going on. Ooh. So did you see my tongue? Do you want me to do it again? So the thing that we are looking for there, okay, so first of all, there's a few red flags that we're going to go through. One of them is if someone has had a stroke, or if they're about to have a stroke, or if there is an issue with a cranial nerve, it might even be a chiropractic thing that they might be able to get sorted out, is the hypoglossal is cranial nerve 12. And how we know there's an issue with that is that the tongue should be able to stick straight out. Even though mine was a little bit quivery, I need some magnesium, it didn't deviate to one side or the other. So if you see someone someone that's had a stroke, the tongue sort of flops out of their mouth because there's been damage to that 12th cranial nerve, and it's sort of like, or one side to the other. So the tongue, yes. So we're sticking it out. We are ruling out a red flag, that cranial nerve 12, and then we are going to start looking at the colour. So when we were looking at my tongue, what was one of the first things you noticed? It's quite pale. So first of all, just to know what's normal, is that a normal tongue should be pink It should have a bit of a white coating on it, but you should be able to see the pink through it. It should be the same on both sides. It shouldn't be beefy or scalloping. Beefy, I mean sort of swollen, and it should just stick straight out. Yeah, so when we are talking about colors again, once again, we're coming back to those patterns, aren't we? So when we're thinking pale, we're thinking about deficient, lacking, and cold. When we're thinking about red, once again, we're thinking about circulation, we're thinking about heat. In particular, with the tongue, we're talking about like too much internal heat, so really fiery, really, and you might find that they, yeah, like I said, they're angry or impatient. And then that purple, that's that stasis of blood, that stasis of heat or energy. And one of the things that I see with that is a lot of women who have, that we use, you Herbies will know that we use Dong Quai for stagnancy of blood, for stagnancy of, menstruation and things like that. And you'll often see purple tongue when you see those things as well, just out of interest. Okay, and then once again, like with our nails, when we're seeing blue, we're thinking about the internal cold, we're thinking about lack of oxygenation. And then you're going to think, why? Why? What's going on there? When we're thinking about the tongue shape, once again, if we're thinking about a person that's very, very thin, it's very frail, there's not much to them, what are we thinking? We're thinking about weakness, we're thinking about deficiency, as opposed to things that are swollen. There's excessive. We see a swollen tongue with hypothyroidism, and the tongue actually ends up, one of the reasons why people get the scalloping, which is the tooth marks on the side of the tongue, is because the tongue is swollen and it pushes up against the teeth and it makes those marks as well. So a flaccid tongue, so that's once again, we're talking about a deficiency. And neurologically as well, there could be an issue with the cranial nerve 12. A quiver, so you may have seen a little bit of a quiver with my tongue before, is when you ask someone to poke their tongue out, you're going to ask them to poke their tongue out near the camera for probably about 10 seconds. Any more than that and it'll just be horrible for them. Even that's quite a lot. But you'll see, and towards the end, you'll see the quiver happen. Yeah, and usually if it's a true quiver, it'll happen quite quickly straight away. And I have mentioned the scalloping as well. So the inability to digest and assimilate food or life. That's an interesting one from a very holistic point of view. And yeah, and you will see that as a hypothyroid sign. Okay, so what's normal and what's not? What's normal is that there is a thin white coat that you can see through the pink color through, as I mentioned. And then what's not normal, once again, when we're looking at patterns of things, the thicker and the darker that we see something, it would make sense to think that the more chronic, the more serious the dis-ease or the imbalance is going to be. When we're thinking about the tongue coating, we're thinking about whether it's thick, whether it's absent, because remember, there's got to be a bit of a white coat. When we're thinking about things being really white, we're thinking about candida, yellow. Once again, we've got excessive heat in the body, and then grey and black. We've got chronicity and extreme. Especially cold, and then brown. You will actually see a brown kind of furry coat on a tongue when someone has been on like quite a strong long-term antibiotics, and definitely with HIV medication. That's really common. Okay, so what did I want to say about that? Please, when you're looking at a coating, once again, bear in mind, is the coating all over the tongue, or is it just in a particular section? The moisture levels. Well, if a tongue is dry, we're automatically going to be thinking about dehydration and lack of vitality. Now, remembering dehydration, that's when we ask how much water they're drinking, but how much are they actually absorbing on a cellular level? Are they just peeing it all out? And then if a tongue is moist and you can kind of see saliva, that's when we're thinking more of fluid retention. That sticky, slippery tongue, it's like, you know, when someone opens their mouth and they have lines of phlegm, and that's obviously phlegmy sort of issues. Skin. So we observe the skin of the face, the neck, and possibly the arms as much as we can see. Now, when we are doing this as well, we also ask them, do you have any skin complaints? They'll go, oh yeah, I've got this rash on the back of my arm. Well, show me the back of your arm. So this is what I mean. Just get comfortable with going, okay, that's what that is. Show me where it is. If it's on their belly, if you would be asking them to show you in person, you're going to be asking to show on camera. And I want you to feel comfortable with doing that. Because if I was speaking to my pracky, my naturopath online, and I said, I've got this rash on my belly, I would stand up and just show them my belly so they could see it. Okay, once again, the colours, when we'll be seeing a pattern here. The yellow, we're talking about liver. Pale, we're talking about deficiency. We're talking about anemia. We're talking about iron deficiency and then anemia. Remember, they're two different things. When we're talking about blacks and browns, we're talking about distorted alimentary channels. And that makes sense, doesn't it? As opposed to the purple and the blue, which is respiratory and lung issues, that oxygenation issue that we were talking about. And here's that milky, pale, yellowy white kind of color, which is seen in lymphatic issues and mucus and phlegmy issues. Okay, we are getting there. Apologies, we have gone over. This is me culling. Okay, so eyes. When we're looking at the eyes, this is not about iridology. That could be another workshop unto its own, and there are some fabulous iridology resources available. So this is literally, I'm getting you to be aware of what you can see. So we're looking for the obvious. So we're looking for lesions and scars. Is there any discharge? Looking for blood. Is there a lot of blood vessels in the sclera, which tells us a lot about allergies and intolerances? Ptosis, when an eyelid is drooping, well, that could be an issue with cranial nerves. It is also seen, especially if it's unilateral. Bilaterally, ptosis, that drooping of the eyelid, is often seen in depression. And also, what are the eyes, holistically, what are the eyes telling you? Like, listen to your gut. What is the message that you're getting from that person's eyes? Okay, so when we are looking at the eyes, that there are, and also, once again, I want you to be assessing things always for symmetry. It's really, really important. You know, when they're looking at a camera, does one eye does it roll away? Is one eye more open than the other? And these are all things that are really, really important to note. Okay, so the eye and possible nutritional deficiencies. So when this is all in your manual, but what I want you to know is that when we look at this chart, I put this chart here because what I want you to know is that those same, sure, there's like the Bs and there's the zinc and there's iron, but there's a lot of fat-soluble vitamins that come through here, like are weaved their way, and it's the same thing over and over again with what's going on with the eyes. All right, let me just get back to a question. What does it mean if one eye is bigger than the other? Yeah, so what does it mean? It means that generally that there's going to be a cranial nerve issue, innervation of unilaterally on one side. Now, the cranial nerves 3, 4, and 6 are the ones that innervate the eyes. And that generally what can happen is there might be an issue from one side to the other. And it might be something that you'll investigate further and question further, or you might actually send them to the GP for a check to see what's going on there. I always think to myself, if we are the ones to catch things, then we have been of service to our people. So, yeah. Instead of it just being like, oh yeah, I do iridology, it's having a look at the whole area. So, when we look at eyes, we look at eyebrows, we look at eyelashes, we look at the iris, the pupil, the sclera, and we look at all of the skin around there as well. We know when we're looking at eyes, when we see big dark circles under there, that's a sign of, well, it could either be dehydration or it could be food intolerances and allergies as well. So what I'm getting you to do is I'm getting you to play Dr. House and just look for those little clues that are there and hiding in plain sight. So when we're thinking about the hair, we are thinking about the hair from the point of view of nails and hair are not essential for life. I don't know if we heard this part. Yeah? So our heart, our lungs, or our brain, they are always going to get first dibs at nutrients, minerals, vitamins, all of the things. If there's anything left over, then our hair and nails and things that are non-essential for life will get the leftovers. So if we are deficient, our hair, all of a sudden, these are the people that say to you, no matter what, in the last couple of months, my hair's falling out and my, it's so dry, it's so brittle, my nails are breaking and flaking. And then you're going to be thinking about, where are the deficiencies? Okay, pain assessment. Pain assessment is huge. Pain assessment is very important. One of the things that I see that everyone does is they ask people if they have pain, whether it's period pain, whether it's whatever it is, and then what happens is they go, okay, can you just rate it out of 10 for me? And then they move on. So pain deserves your attention. When we are talking to people about pain, the PQRST method is the way to go. So when we are talking to them about their pain, so their period pain, what makes it better? What makes it worse? When we're asking about the quality of pain, what's the pain actually like? I encourage you to take to allow them to use their own words, and then throw some into the mix if you're finding they're getting a little bit stuck. The region and radiation, so where is it and does it move? This is really important. So, ask them to either tell you where it is, or point to where it is and show you. And then does it radiate? Does it move anywhere? And has it always been in that spot? Severity, it's more than just rating it out of 10, because if you see someone in the morning and they're a 1 out of 10, and then by 5 o'clock in the afternoon they are a 10 out of 10, then you've dropped the ball. So what you want to be doing is you want to be asking them, what is the severity of pain right now? And what about when it's at its worst? And what about when it's at its best? And timing is also really, really important. So that ties in with severity. So when did the pain actually start? How long has it been hanging around? When does it, how often does it occur? Is it all the time? Is it daily? Is it weekly? Is it monthly? Is it seasonally? And then you, by just having this conversation. There's a lot of people that are really not heard with their pain, and with the comorbidities with depression, I really encourage you to just give pain a little bit of space and the respect that it deserves. Okay, so we've got a couple of red flags with pain. So they are written there. So we've got fever and we've got chills, weight loss. You can read the list there. When I talk about increase in severity and frequency of pain, acute or chronic, what I encourage you to do is to set your ego aside. And if you are treating someone's pain and it's not getting better, then you really have to look at why. And do you need to refer? So be safe with this, and and make sure that with pain that you have checked to see if those things are concurrent as well. Okay, the mental state assessment. This is actually sort of done throughout your consultation. There is when this is the same sort of assessment that conventional medicine does as well. So once again, you can, like pain assessment, they use that as well. You can add this information into your referral letters if you end up doing those. But we observe, we listen, we ask appropriate questions, we interpret pathology testing, and we refer if needed. So when we're thinking about this so when we've got the person in front of us, if we have any type of inkling that there's some sort of severe mental state stuff going on, then we'll dive deeper with our questioning. But in general, it's sort of something you're thinking about in the back of your mind as you are listening to them talk. So their appearance, are they clean? Are they tidy? Are they dressed appropriate for the weather? If you know where they live, it's 40 degrees and they don't have the aircon on and they're sitting there with jumpers and jackets on, or they're sitting outside underneath a tree in a tropical place talking to you, and they have got big jumpers on, that's a red flag for me. And then obviously the clean and tidy thing is, we know that they are very closely related to depression as well. So alertness. Once again, this is made for the medical model, but can they remain, for us, it's can they remain focused on the conversation. Now we know with our adrenally fatigued clients, they'll go off on tangents. They'll go off here and then they're off here and then they're there, and they're too busy talking to answer your questions sometimes. But you should be able to hold a conversation with an adult and have that back and forth with them. Speech. So, are they able to articulate words? Is it relevant? That's a really important one. Behavior. So making sure that they're friendly and they're cooperative. I mean, no one comes to see us under duress. They are then generally there because they want to be. There's the odd husband that gets sent to a naturopath because their wife's just sent them along. But for the most part, it's not. Yeah, they're not under duress. So, is their behaviour appropriate? Are they really, really gushy towards you? Are they very, very aloof? And that's a mental state, part of the mental state assessment. Orientation. So they obviously know where they are and who they are, and they can articulate all of that. Mood. We do that all the way through as well. So are they depressed? Are they anxious? Are they angry? And importantly, does that change throughout the consult? So 5 minutes are like this, and 5 minutes later they're like that, and it's a roller coaster just keeping up with them. So there's these little nuances that I ask you to keep in the back of your head when you're seeing people. It's really the icing on the cake. Okay, your thought processes. So the thought processes, are they logical? Are they organized? And are they able to stay on track? When you ask a question, what's the weather like where you are? And they say orange. you know, that makes no sense. I know that's quite extreme, but you know, unless it's adrenal fatigue, they should be able to rein in and answer you. And the thought content. So you know, what is the actual content of their thoughts? What are they thinking about? Are they very phobic? Are they very anxious? Are they very fixated on things? Are they paranoid about things? And then obviously there's hallucinations and delusions as well. And especially if you know someone has a current or a past history of severe mental health issues, this is something that's going to be just in the back of your mind as you're chatting. Okay, so this is not a suicide prevention training, but what I just wanted to get out on the table straight away is that that when I was reading the research about this, is that if you think that someone is capable of suicide, by asking them the question, there has been absolutely no increase in the rate of suicide. So I just encourage you to be able to ask, and then, you know, is this what you're thinking about? And if they say no, you'll get no. Oh, and you'll know that it's a no, and that's cool. Just move on. But if they say yes, the very next question is, do you have a plan? Once again, that has been shown to be okay to ask. We don't have to be psychologists to ask those questions, and there's not going to be the negative consequences that a lot of people think there is by, it's not we're not putting ideas in their head. There's no ideation with the asking. So have you been thinking about suicide, and if yes, do you have a plan? And then from there, it's actually going to be your discretion as to what sort of happens next. You know, there is if you are generally not too concerned, then you might send them to the GP for a referral for a mental health plan, right up to, if someone is very, very distressed and you're very worried about it, then you can keep them on the video and call an ambulance for them. Okay, so we've got to the end of, now obviously these are some of the things that you can do in your online consultation, and I really encourage you to get out and tell the world what you can do and how you can help people. It's at the moment, it's the cake is having us dissect their health and formulate treatment plans. The icing on top of that cake is being able to identify all of these little cues, all these little nuances, all these little things that create a rapport and just give us that little bit more about our people. And this is all of this stuff. So when I say tell the world what you do and how you can help, tell them that every time you jump on a Skype, a Zoom online consult with me, I'm going to be looking at your tongue, I'm going to be looking at your nails. I have a way of assessing your waist-hip ratio to assess your cardiovascular risk. I have a way of taking your pulse so we can see what's going on with your vitality and your adrenal function. People are just absolutely enthralled by this stuff. They really, really are. So I encourage you just to, we know that especially with the free algorithms on social media, they're just horrible. So you could be posting 10 times a day and you wouldn't be annoying anyone. But just get out there and tell people what you do. Because people don't understand an online consultation. They don't understand how much you can connect and how much information you can get. And this hour and an hour and 40 minutes is on top of all of that incredible questioning that you're going to be asking them. So you have an opportunity, and people will will really be interested in this. Okay, so thank you. I am committed to bringing easy to understand physical exam training to natural health practice. You can see all of my work on my website. I do workshops, and I do and there's the full online package as well on my website. It's there's so much more. There's so much more that I could give you, and I already knew that I wouldn't be an hour with this. But I feel like this is a really good start, and especially where we're at the moment, if you can get people to be looking at this stuff with you, then you can be really, really helpful.